Hello everyone, my name is Ellie Curtis and my PowerPoint presentation is about attention deficit hyperactivity disorder, also known as ADHD. So what is ADHD? According to the National Institute of Mental Health, ADHD is a developmental disorder marked by persistent symptoms of inattention and/or hyperactivity that interferes with functioning or development. Who does ADHD affect? It was traditionally thought to just affect children and teenagers. Now it is recognized that people with ADHD do not grow out of it and often occurs into adulthood. An estimate of 7 million U.S. children ages 3 through 7 have been diagnosed with ADHD according to the National Survey of Parents. Some common signs of ADHD include aggression, excitability, fidgeting, hyperactivity, irritability, difficulty focusing, problems paying attention, a short attention span, boredom, mood swings, depression, and learning disabilities. Some different treatment for ADHD include medications and therapy. All ADHD medications work by increasing the level of neurotransmitters in your brain, and these 3 medications are the most common. Therapy includes support groups, cognitive behavioral therapy, anger management, counseling psychology, and family therapy. Some common oral findings include cavities, gum disease, xerostomia from medication, dental trauma, lip biting and cheek chewing, and teeth grinding. So what is the role of eye hygienists when treating patients with ADHD? Understanding their condition and how it can affect their oral health, scheduling appointments early in the morning when a patient is more attentive, providing clear instructions one at a time to allow the patient to process the information, use positive reinforcement, limit distractions using a quiet space, and soothing techniques. So meeting my patient, his name was James Adams. He was 4 years old. He was a male. He was in pre-K. His parents or guardians were his mom and dad. Some interests included video games, RC car racing, playing with toys, and running outside. And something that I noticed upon meeting my patient was that he kept covering his mouth with his hands. So at first glance, when I brought my patient back, he was very scared. He kept covering his mouth with his hands. Before trying to check intraorally, he was complaining of severe pain and did not want me to look inside of his mouth. His medical history, so his medical condition was ADHD. There were no contraindications for treatment. He was shown to be physically active and healthy. He was mentally stable but was very scared about his first dental visit. He did not comprehend OHI. He was in and out of the chair. He only wanted to play with the air water syringe during the appointment. My patient was alert and wanted to play in the chair and had no vision or hearing problems. So the nutritional status of my patient. My patient did not have the healthiest nutritional choices. He does like to snack on soft foods. He said he does not like to eat crunchy foods due to the pain that is currently occurring. His diet included pancakes, chicken nuggets, french fries, applesauce, chocolate milk, sweet tea, strawberries, and corn. So medications. There is no medication taken at this time due to his age. There are also no ADHD medications that are contraindicated for treatment. And then people taking stimulants may experience bruxism and dry mouth, which is also known as xerostomia. Dental history/concerns. So this was my patient's first dental visit. His chief complaint was that he was coming into the office due to severe pain. Intraoral findings were cheek and lip biting, a bruise on the right cheek, and his mom said that he usually has a bruise on which side of the cheek that he is currently biting. And he had a sore on his hard palate, and that was from eating too hot of chicken nuggets last night, and his tonsils were inflamed. My patient had all primary teeth present, A through T, no permanent teeth present, and then TMJ bilateral crepitation. His radiographic assessment, we did modified bite wings. We had him bite on the x-ray plate with his anterior teeth and put the PID up above his nose for the maxillary shot and underneath his chin for the mandibular shot. We did not do a pan due to his age, and he did have rampant caries. He did not have any orthodontic appliances or removable appliances. So the condition of my patient's mouth, he had generalized plaque buildup, gingivitis, and noticeable rampant caries. He had generalized plaque, could not calculus detect, loose debris was present on anteriors, halitosis was present, and his PHP was a 2.4, which fell into the fair category. My patient does grind his teeth. His tonsils were present, but they were red and inflamed. And for home care, my patient did not seem to know what a toothbrush was. When I brushed his teeth during the appointment, he acted like it was new to him. So taking that into consideration, I'm assuming that he does not brush or floss at home often or possibly ever. My patient's home care aids are a manual toothbrush. So can my patient brush his teeth? I do believe that my patient could brush his teeth with the correct guidance. And then with ADHD, it can make it difficult to constantly brush your teeth due to challenges with focus, memory, and routine care. So during the treatment phase, dental findings, he presented with rampant caries. Specific teeth were not determined as he would not let us check each tooth. Gingival findings, maxillary and mandibular papillary were red, bulbous, and smooth. Maxillary and mandibular marginal was red, spongy, and inflamed. Periodontal findings, he would not let us in his mouth long enough to do a PSR. He was in and out of the chair during the appointment and just very apprehensive. Treatment provided was medical history, intra-extraoral, OHI, x-rays, polish, and I did do silver diamine fluoride. Communication problems, he did not listen to OHI, did communicate with his mom about proper brushing and flossing techniques, and then he did not cooperate. He was very nervous throughout the appointment. He would not open for very long due to the pain. He would not sit in the chair and kept trying to get up. And I did do silver diamine fluoride because it helps with tooth sensitivity and used in children with high risk for caries. And then biannual 38% silver diamine fluoride is used to arrest advanced cavitated lesions in the coronal surfaces of the tooth. And this also can cause tooth staining. So things I changed during the appointment. I played RC Racing video on the computer monitor. I made a glove that looked like a little octopus. I had a stuffed animal that he could squeeze or play with. I made sure to simplify all instructions. And I did have his mom sit in front of him on the dental chair about halfway through the appointment because he just would not stay in the chair. This was my patient's caries and periodontal risk assessment. He was high risk in the caries risk assessment and also high risk in the periodontal risk assessment. And then this is the picture of the x-ray, and as you can tell, his two front teeth have very rampant caries on them, along with many other teeth that were present. So oral hygiene recommendations. This was primarily focused towards the mother since he was not comprehending my OHI, but I told her to start brushing his teeth every morning and night with a soft bristle brush. I told her to have him brush his teeth in the morning and have mom or dad brush at night. Use a fluoridated toothpaste. Begin flossing once a day with a handheld flosser. Talk to his mom about the importance of limiting snacking, especially soft foods since they are more cariogenic. And if eating soft snacks, it should be consumed with a meal. And a referral was given for the rampant caries, and I also put him on a 3-month recare. New techniques. Most of the oral hygiene recommendations are new to him. As I stated before, he seemed unfamiliar with a toothbrush when I brushed his teeth during the appointment. During the appointment, I focused on proper brushing techniques with both him and his mom, making sure they know to brush with a soft bristle brush 2 times a day for 2 minutes with a fluoridated toothpaste. And this was something that I just found unique. So I found an acronym, UNCAPT, and it can be helpful for anyone who is supporting a child with ADHD during a dental treatment. So the U stands for understanding your patient or child, N for non-judgmental attitude, C for calm, A for attitude, keep a positive attitude, P for praise, be generous with a positive praise, P for patient, be patient with your client or children's needs, E for empathy, and D for directness. And this is my reference page. Thank you guys so much for listening.